Yeah, so let's just try to get through it all, and then I'm happy to answer questions at the end. And so tonight we're going to talk about alcohol in your health. Two things that we don't typically put together. You know, typically when we make a list of all of the things that we think about when we think about healthy people, drinking a lot of alcohol does not appear on that list, right? So, but alcohol is a fishy kind of thing, and there are some benefits to drinking alcohol. So we're going to cover the science tonight, because you guys know that I talk all about science, and we're going to cover the objective science when it comes to alcohol and talk about all the good things and the bad things that we associate with alcohol, including some of the good health consequences. Okay, so here's what we'll cover. First of all, is alcohol healthy? We're going to talk about that right up front. The answer, of course, is both yes and no, and we're going to explore both sides. Number two, everything you should know before you drink. So this is going to be like our alcohol 101 class, things that all people should know, but most people don't, or don't think about very often. Third, we are going to talk about the effect of sugar. So my low carb people will be really interested in this part, but the effect of sugar and alcohol on your diet. And the effect is pretty dramatic when you start cutting out sugar. So we're going to cover some of the science there. And then number four, we're going to talk about the actual pros and cons individually. So we're going to weigh the benefits and risks. So by the time you're done listening to this tonight, you should be able to decide for yourself very well whether or not you want to continue to include it or you want to cut down. So just how much alcohol you want to include in your life. So, okay, this is question number one. Answer this first. Is alcohol good or bad for you? So since I'm in the unique position of being a doctor that has no paid advertisements, no lucrative endorsements, I can tell you 100%, if you want to be healthy, you need to be educated about your alcohol intake. And you need to be educated about how much is too much, and how much is too much is individual. So we're going to learn that tonight. But to be clear, alcohol is a toxin. It's 100% a poison. So that means it has both good and bad properties, believe it or not, when it comes into your body. So used incorrectly, though, it is a universal killer. The younger and smaller you are, the more dangerous this poison is for you. So that means, you know, as far as children, you want to keep our little kids away from alcohol. So you want to keep it up high and keep it locked if possible. I'm speaking to the grandparents here, especially, because parents are really keen on, you know, what's going on with the kids and making sure that they're safe and doing all these safety measures. But grandparents forget about this stuff and very often walk out of the room and leave alcohol with little children like this, and this can be very dangerous. So grandparents, great-grandparents out there, we got to be careful about this. And then also just a reminder that as our kids get older and older, they need to be educated and re-educated and re-educated in an age-appropriate manner about alcohol. So they need to learn all this stuff that I'm going to teach you tonight. The discussion of alcohol is always really interesting, right? I mean, people get, it's similar to the discussion of sugar that I have with people. So you mentioned like the possible giving up of alcohol in mixed company, and you're going to hear like a ton of really strong opinions come at you. And then you're like, whoa, where did that come from? You know, people are very protective, very guarded, very opinionated when it comes to alcohol. And, you know, they get that feeling like they have the right. There's nothing wrong with it. It's not hurting anyone. They're absolutely not addicted. Why would you say that? So it's there's a lot of emotion tied up with alcohol, similar to what I face all the time when I'm talking about giving up sugar with people, right? So anytime there's anything that causes that much emotion and you have that much opinion about it, you want to make sure that you understand your own drivers and you understand what is causing you to feel so strongly about that thing. And you want to make absolutely certain that you're well educated about your opinion, right? No, none of us wants to be an idiot. So you want to be very well educated if you have a very strong opinion about something. So one of the first things to understand about alcohol, though, is that we all start getting educated, whether we like it or not, from the time we're little. And we get educated in lies. So what you're looking at here is a typical beer commercial, right? Everyone's young and healthy and beautiful. Nobody appears sick. Everyone's having a good time. So these subliminal messages that we get about alcohol are overwhelmingly positive, right? Just like the messages that we get about sugar. Like, you can eat all the sugar you want and everything's going to be fine. And, you know, Snickers keeps you satisfied, right? Like, it's a bunch of lies. So understanding that alcohol manufacturers they own the message, they own the airwaves, they buy the narrative. So overwhelmingly what you hear about alcohol out there is going to be in a positive light. So a lot of the negative stuff that I'm going to talk about tonight, maybe some of you will have never heard about. So alcohol manufacturers are one of the strongest, most powerful lobbies in Congress. They spend almost $30 million lobbying to oppose taxes on alcohol, to oppose labels on alcohol, right? There's no alcohol that you buy that suggests a serving size. That is the work of these guys in politics. So, and it's only since 1989 that there's actually a Surgeon General warning on alcohol about, you know, this could be dangerous for your health. And that's just about what it says. So, and that $30 million may sound like a lot, but let's see, I have this written down. The market in the US alone in 2021, they earned $2 trillion from us, $2 trillion. That's 1 billion times 1,000 is a trillion. So that's $2,000 billion. So that $30 million that they use on lobbying is absolutely nothing. So that's why you're going to hear just all the positive things about alcohol and not a lot of the negative. All right, but the fact that alcohol is a poison is not a disputable fact. Alcohol is a poison. Alcohol is a direct toxin. So chemically speaking, alcohol can dissolve in water and it can dissolve in fat. So what that means is it can get right into every single cell of your body, any cell that it comes into contact with immediately, without invitation, without needing to be absorbed through a protein, nothing needs to happen. So alcohol affects every cell, every organ, every body system. So what does that mean? So many of us use alcohol to clean things, right? It's like hand sanitizer contains alcohol. The things you clean your counters with often contain alcohol. That's because alcohol has the ability to kill things on contact. So it can kill bacteria, it can kill viruses, right? A drop of alcohol in a Petri dish will immediately kill all the bacteria in it. So these alcohol cleaning agents are not that different than the alcohol that we drink. So like desperate drunks will walk into Walmart and drink Listerine, drink hand sanitizer because it contains alcohol and that's how they're getting it for free. So just a reminder, so you're a living organism as well. So that means a tiny bit of alcohol is not likely to kill you like it kills bacteria, but the more you drink, the more likely it is to damage you and can actually kill you. So there's thousands and thousands of diseases, some of them I'm showing here, that are associated with alcohol use. And we're going to talk about those right up front. I mean, alcohol dependence is the number one problem with alcohol, right? And this isn't just a social, political, economic type issue anymore. Recent science has actually proven that alcohol makes changes in the brain that cause you to become more dependent over time. So alcohol dependence itself is a disease. Okay, liver cirrhosis is probably the one that people know the best. So people know if you drink a lot of alcohol, you're most likely to run into liver disease, but not a lot of people know what liver disease looks like. So this is liver disease. So yes, your liver is your primary organ for detox. So anything that comes into your body that's a toxin is going to get processed by the liver. So it makes sense that alcohol really wrecks your liver because your liver is trying to save you. And in the process, it gets wrecked. So this is liver cirrhosis. Not a lot of people know what it looks like because typically when people get this sick, these people are pretty much all end stage cirrhotic. They have about 2 years to live. And in those 2 years, most of them are very confused and suffering a whole lot. So it's not that often that you see these people out in public. Occasionally, you may see one of these people on a bar stool before they realize that they're sick. So if you ever see anyone that is yellow, like that guy there, make sure that they know it. Sometimes it happens so gradually that people don't even really appreciate that their skin and their eyes have completely turned yellow. And that's a really bad sign. So, all right. And these guys typically don't end up on a transplant list because why? Because they're alcoholics. So, you know, that causes a lot of controversy when we give a good liver to an alcoholic who's just going to wreck it again. Typically, that's not an option for them. All right. So the liver tries really hard to take the heat when you drink alcohol, because if it can't keep up with the processing, then the next thing to get affected is typically your brain. So, and you know, alcohol has a lot of changes on the brain, but it's damage that's constantly occurring from the moment you take one drink that your liver can't handle. So you don't want to go beyond what your liver can handle. All right, so the direct toxic effects that occur are seen here on the slide. And you may or may not know this, but the drunkenness effects of alcohol come from the poisoning itself. So when you think somebody is drunk or you feel drunk yourself, like you feel that buzz effect, you have been poisoned. People talk about being poisoned by alcohol as like the severe effects, the most severe effects. Then we say, oh, they've been poisoned. But it's the moment you feel that buzz that you've been poisoned. So, and this is why pace matters a whole lot when you've been drinking. So like if you're a young person, you know how young people love to walk into a party, drink 4 shots, and then, you know, and they feel fine, but then 20 minutes later, they've gone way beyond what they should have, and the effects won't hit them for 15 or 20 minutes later, and by then it's too late, and they have been poisoned. And what happens? All these lovely things. So first of all, you have the effects that you see here. So a little bit of confusion, a little bit of lack of coordination, some nauseousness, may lead to vomiting. You will see the effects on the brain in the eyes. So your eyes are actually an extension of your brain. And that's why, you know, as parents, we can tell immediately when our kids have been drinking, because they walk in the door and they have this weird, like wide-eyed kind of look, like a deer in headlights. That's because alcohol has a direct effect on your pupils. It causes your pupils to dilate, like you see here, and it causes them not to work very well. So our dilated pupils don't shut down very well. That makes our acuity or ability to see very clearly go away, which is like what we talk about with like when people talk about beer goggles, right? Everybody, the night that you're drunk, looks beautiful compared to the following morning. That is a universal thing, and it's because nobody was seeing very, very clearly the night before. It's also the reason why at the end of the night at a bar, the bar owners will flip the lights on, because that will cause anyone in the bar, like a vampire, to go running out of there, because they can't stand the bright light with their pupils being open so wide like that. So anyway, that's one of the first signs. But if you get any of these other things going on at that first buzz, so you don't have to have the eye thing, you may not be looking in the mirror, but that moment that you feel a little bit dizzy, a little bit off, a little bit like your vision has changed just a little bit, that is the first sign that you've been poisoned. Poisoned, just like in the movies. So think about it. If you're a movie star, how might you behave if you're trying to act like you've been poisoned? This is it, right? This is it. You're stumbling, you're a little confused. So alcohol drunkenness is poisoning. So anytime somebody asks me about, you know, is somebody poisoned as an ER doctor, I get asked all the time, are they poisoned? What are the signs? Anytime you've been drinking, you've been poisoned, okay? So that's new, it may be news to you. But pay attention to those bottom things. Those bottom things are really bad, okay? So if your friend is so drunk that they have peed themselves, if they are lying outside in 30-degree weather with no coat on, we got a problem, right? Our bodies work best at 90 degrees. That's why we keep 98 degrees as our temperature. That's where our immune systems work best. So that's why when you're out drinking in a crowd, so many of us get sick in the next day or two, because we have had so much exposure and we let our immunity wane off because we've been drinking too much. So, okay. And what can I do for people who are drunk or poisoned, even severely poisoned, when they're brought to the ER? Nothing. We do nothing. People are always like, save them. Oh my God, what can you do? There's nothing that you do. Alcohol poisoning is not reversible. Only time reverses this. There is nothing that we can do to pull alcohol out of your system. So we can support you. That doesn't mean don't come. We can support you. We'll watch you like a hawk. We'll stick an IV in you and hydrate you. We can give you things to help you with your nausea. If you're not breathing very well, I may throw you on a ventilator, but you never want to get that far, right? Okay. All right. So aside from those immediate effects of alcohol, the other immediate effects are the ones that have to do with brain modulation. So the ones that have to do with our behavior, our mood, our motor skills, and how we perceive those things. So we think that things are okay when they're not. So when somebody says to you that you're behaving poorly and suggests maybe you get out of here, maybe you stop drinking, they are always the one who's right, not you. Just that's a tip. They are always the one that's right because you're not judging the situation as well as you can. So our slow reaction time, this ruins our decision-making ability, including our judgment. So as a result, people who are drinking often place themselves in very high-risk situations and situations that are prone to injury. So I'm showing a lot of those on the screen here. So if you look around, it's, don't drink and swim. Don't drink and bathe. Don't drink and drive. Don't drink on the job, especially if you have a job where you're using, big machinery. Let's not do that. Don't drink and climb, like where these guys are going on rocks, on a mountain, I don't know. And then these other things are just showing what happens with this poor behavior. Alcohol causes what we call a top-down impulse inhibition. Top-down. Top-down means from the top of your brain. The top of your brain helps you do all of the discerning decision-making about what would be best. What are the best things to say? What are the best things to do? So people that are drinking are often not making the best decisions and certainly not doing things that they wouldn't do on other days. So this woman that's arguing with somebody bigger than her, this woman that is peeing in the men's bathroom. These are all things we wouldn't normally do on a day that we're not drunk. So this top-down inhibition, though, is interesting because it is one of the reasons that people with anxiety will medicate with alcohol. So things like anxiety, depression, worry, these are all things that happen in our higher brain, in our top of our brain. So when you're drinking, you can effectively take these things away. And that's one of the problems with alcohol. The worst effects of alcohol in the brain happen to be in the memory centers. So that's why people get blackout drunk. Okay, that doesn't have to do with passing out. That doesn't mean they passed out. It means they continued through the night and just have no memory for what happened. And you should know that these little effects that we're talking about for chronic overuse of alcohol become permanent. So that top-down effect of disinhibition means that for people who are chronic alcoholics and chronically abusing alcohol, all of a sudden they can no longer modulate their behavior ever. So they start misbehaving in a number of situations, even when they're not drunk. The other effect on the memory is that memory can be impaired forever. So the type of memory that's the hallmark of having been drinking too much throughout your life, the type of dementia that we associate with alcoholism is that of forgetfulness of memory. So you start actually making up a lot of stuff. All right. All right, so back to some of the other effects from this slide. The other direct toxic effects. Alcohol can cause heart failure, right? It can affect your pancreas, which is important in digestion, also important for the development of diabetes. Acute pancreatitis is one of those very painful recurrent things that we put people in the hospital for all the time, most often associated with alcohol abuse. It can affect fertility. So for both men and women, alcoholism can cause infertility. For women, we know that just more than 2 drinks a day can cause infertility. For men, we know that it lowers testosterone. And then atherosclerosis we'll get to. It does cause hardening of the arteries, but there's other effects of alcohol that sort of have a reverse kind of effect for that. So we'll talk about that in a minute. Alcohol also causes direct injury to the esophagus and the stomach, and that's associated with ulcers and can also be associated with cancer in the esophagus and stomach. And here's a link that I think we don't talk enough about, or we don't hear enough about. Because alcohol is a toxin, it is a carcinogenic. That means it causes cancer. So here's a list of the cancers that we now associate with alcohol abuse. And these occur in linear fashion, meaning the higher the number of drinks you take in a day, the more likely you are to have any one of these things happen. For women in particular, this is a really big deal because you see that top number there. So for women, having more than one drink daily increases your risk of breast cancer by 30%. That's a lot. That's a lot. And if you already know that you're at risk for cancer, that's a very big deal. Aside from the actual diseases caused by alcohol, there's of course the risk of injury, and there's the social toll. So not only can your abuse and addiction wreck your life, but it can wreck the lives of others. So alcohol worldwide is the leading risk factor for injury and death related to both intentional and unintentional acts. So 16% of worldwide deaths and 13% of worldwide disability due to alcohol. That includes here in the US, 31% of all traffic crash fatalities involve drunk drivers, 31%. 55% of domestic abuse perpetrators admit that they're using alcohol prior to the assault. Women who are abused are 15 times more likely to abuse alcohol themselves. Up to 75% of individuals who experience any type of trauma report alcohol as a coping mechanism. 40% of convicted murderers admit to use of alcohol prior to their murderous act, and 30% of suicide victims are found to have alcohol in their system. So in terms of, that top-down inhibition, it's a big problem. We do all kinds of bad things when we have alcohol in our system. We know that there's a significant overlap between alcohol and psychiatric disease, and this is just from self-reporting. So not everybody who is drinking to have a good time, right? A lot of us are just using it to cope. So I just put this up there just so that you think about it for yourself. So the next time you find yourself grabbing for a drink, just do a little self-assessment and try to conclude, is this your coping mechanism? Are you drinking because you're sad, you're mad, you're angry, you're lonely, you're worried, or any of these things? So if it's any of these things you need to know, none of that will get better with drinking. All of that will get worse with drinking. So you need to find a better coping mechanism. All right, part 2, things you need to know before you drink. So safety is the #1 reason you need to know this stuff. It's easy to guess who has been poisoned here. Right? Probably all of these girls have been poisoned, but we know who has been poisoned the most. So how you handle your alcohol largely depends on a few things. It's your size. So the smaller you are, the less alcohol you can handle. That means, ladies, if you go out on a date, you don't split a bottle of wine. If you do that, you're going to be way more wasted than that guy, way more likely to be taken advantage of. So just keep that in mind. If you're the lot smaller person, you can't handle as much. Therefore, you shouldn't try. Okay. It also depends on your tolerance. So if you've never had alcohol before, you're going to be way more drunk than anyone at the table who has had alcohol. The more exposure you have, the more ability you have to process alcohol. The third major thing is genetics. So it's whether or not you actually have the enzyme, and this largely depends on culture. Many of the cultures that have alcohol as like a feature means they handle alcohol well. Cultures that don't have this enzyme, two are really well known. Asian cultures and Native American cultures have much less of the enzyme needed to process alcohol. Therefore, they get a lot sicker when they drink a lot of alcohol and tend to not have that as part of a cultural identity. Okay. What else? Oh, so yeah, there's many outside of the scope of tonight, many things that affect how quickly you become impaired, but this includes, how hydrated you are. Have you had anything to eat? We'll talk about that. And generally how mentally and physically fit you are. So the older you are, the sicker you are, the more likely you are to get a lot drunker. So if you take grandma out for Thanksgiving meal and she hasn't had a drink in over a year and all of a sudden she's drinking and she's not as well as she was last year, you're likely to end up in the emergency department with grandma. Trust me, I see that. I see that all the time. All right. And then mixing different alcohols and all those. So there's a lot of other things to know about the things that affect how drunk you become, but that could be a whole other lecture. So, all right, let's talk about the important stuff. Drink equivalence is something that not a lot of people learn, but everyone should know. So these drinks are called the drink equivalents. That means that each one of these has the same potency. It has the same amount of the alcohol in the drink. So, and that is called the standard equivalent. So that is the same for 12 ounces of beer, 8 ounces of malt liquor. So these are your things like White Claws, your hard lemonades and your wine coolers and stuff like that. 5 ounces of wine. So if you pour yourself more than 5 ounces, keep in mind, you're giving yourself a double dose. That's 2 glasses of wine if you fill this up, okay? And a standard shot, which is 1.5 ounces. So if you drink anything that you would, a distilled spirit, so that means your vodka, your gin, your rum, your tequila, your whiskey, if you regularly drink any of those and you're not used to pouring them into a shot glass or you don't own a shot glass, you need to, because that's a standard. That's a well-known standard. I was with my son on a skiing trip recently and he was just pouring alcohol into a glass and I was like, whoa. There were plenty of shot glasses on the counter. I said, you need to measure that. That's not okay to not measure how much is going in, because in general, you're going to pour yourself way too much. So you want to pick a drink, know the facts in terms of how strong it is, and then be careful because certain drinks actually advertise that they're higher potency, right? Like some things say like we're extra high potency. So for wines, like reds are typically stronger than whites. But there's some whites Zinfandels that can be 15% alcohol. Some port can be 20% alcohol. So sparkling wines and champagne typically have less, but it's important to know whether or not you're drinking a standard alcohol or something that's extra strong. And then also to know exactly how much you're getting and to see it be poured. So you don't want somebody else to pour your drink and have put, 4 shots in what you thought was a 1-shot drink. Okay. So, all right. This slide is especially for my low carbers out there. So my low carbers always want to know, will drinking ruin my figure? Can I have a great figure, be nice and lean and include drinking? Yes, absolutely you can. But you need to know how to keep a lot of sugar, primarily sugar, and a lot of calories. And usually it's the sugar that leads to the calories out of your alcohol. So it's important to know where the zeros are, okay? Zeros include your gin, your whiskey, your tequila, and your vodka. And I have rum question mark there. What about the rum? So rum you have to be careful with because rum is made from sugar cane. So not all rum is 0 carb. So pure rum should be 0 carb, but things like specialty rums like Captain Morgan, that's 1 carb per shot. Coconut rum like Malibu, a lot of people love Malibu, that's 11 grams of carbs per shot. So a lot higher for Malibu. Most wines, you always want to go with a dry wine. If you're trying to stay away from carbs, you can taste the sweetness. So obviously the sweeter it is, the more carbs it has. Things like Prosecco and champagne, bubbly things tend to have a lot less, like I said. And be careful of the sweetness, because I always say sweet calls to sweet. So if you're adding sweetness into your night, now you're battling 2 things. You're battling this alcohol addiction and the sweets addiction. And both of those things are going to combine to make you very, very hungry. All right. The other thing to be careful of are these special skinny drinks, right? Not every bar is so specialized that it can make your favorite skinny margarita or your skinny bitch. What's the skinny bitch? The vodka soda drink, right? So not all bars have diet tonic. So if you order a gin and diet tonic thinking that you're going to get 0 carb, be careful. If you get plain tonic water in there, plain tonic water has about 38 carbs in it. A lot. And you wouldn't think that, right? So you got to be careful. All right, beer. This is for my men. Beer is liquid bread. Beer is so fattening. Any malted beverage is fattening. So loads of low carb versions are now out there. Loads of them. This is one of the newest, this Bud Light Next. So not all of them taste as good as others, but if you're a beer drinker, you need to choose these. Just absolutely. You don't want to be doing things, you don't want to go stronger than you need to. You don't want to drink more carbs than you need to. Your beer does not need to fatten you up. Okay, so just for kicks, let's check out the carbs on some of our favorite vacation drinks, right? So take a look at the bottom here. Long Island iced tea, 50 net carbs. Wow. Pina colada, 87, right? And all of these things can be made in a lot of different ways. So you kind of never know what you're getting, but it's no wonder you feel like you're on an instant vacation when you have a pina colada, right? Because the endorphins associated with that much sugar is pretty high. And we never, like, what's the universal answer when somebody says, are we having another? Of course we are, right? So this stuff goes down way too easily. So you want to avoid that if you're trying to stay healthy and you're trying to have that nice lean figure. Okay. Will drinking screw up my results? Part 3. All right, this is Darren. So we're going to learn some of the specifics that I teach about this. So other than what to drink, it's also how exactly to drink. So you'll see Darren here. I mean, it's funny. He's one of my only before and afters that actually include drinks in both pictures. But what I love about this is when he's really fluffy, he's drinking a beer. And when he gets very svelte and dapper, he's drinking like a cocktail, right? So this is what I teach all of my men. You have to get away from that beer, man. It's killing you. All right. So step 1 accelerator. You should all know that I generally do not recommend anyone be drinking when they go through accelerator with me. And that is because accelerator is an experiment and alcohol really muddies up that experiment with learning how your day-to-day calories and foods are affecting you. So you throw alcohol on that and it just kind of, we don't get the clean results that I would like. But does that mean that you can not drink when you go low carb and you won't get the results? Absolutely not, right? Here's my buddies. So this is us at a bar, right? And between the 4 of us, we've lost probably over 200 pounds. I mean, I've lost 80 pounds myself, right? So yes, you can do this, but believe you me, these ladies are all very educated in what I'm about to tell you and more. So they know what they're doing when it comes to drinking and how to stay lean. So here's a sneak peek at some of my evolution education. So that's step number 2 with me. In Accelerator, I don't talk a lot about alcohol because I don't want you drinking alcohol. I want you to figure things out before you throw this into the equation. But okay, this is those standard drink equivalents again, right? So each one of these, that means each one of these contains 14 grams of pure alcohol. So therefore, 14 grams will give you that buzz most of the time. If not, that next 28 grams will get you there, right? So you should know this in your head. The reason why you want to know this is that pure alcohol has calories. So just because something is 0 carb doesn't mean 0 calories. So that's just in the alcohol portion alone. That's before you start adding anything in, okay? So 0 carb does not mean 0 calories. This is evolution type material. So very important to know though. So if you eat protein, 1 gram of protein equals 4 calories. 1 gram of carbohydrate is 4 calories. 1 gram of fat is 9 calories. And for my keto geeks out there, my low carbers, 1 gram of ketones, also 4 calories. But look at the alcohol. 1 gram of alcohol is 7 calories. That's almost as much as the fat. So when you're taking in alcohol, it's as if you melted butter and you're drinking it, right? Almost. But the butter is better for you. The butter actually offers you more. The alcohol is empty calories, right? There's just nothing. There's nothing that alcohol does for you other than poison you. So 4 drinks. So that means in one 14-gram alcohol drink, one of those drink equivalents, no matter which one you choose, you're getting 100 calories. So that means if you have 4 drinks in a night, you're taking in 400 extra calories in the alcohol alone. That's a lot. So for us ladies, some of us only have, 1,200 calories or less in our day. So 400 of those come from empty calories of alcohol. That adds up to a lot of extra fluff fast. So I brought this slide back just for fun again, just so that you can see when you add the calories of alcohol into the calories of other things, you end up with a lot of calories when it comes to those bottom drinks. So take a look at like your 0 carb tequila, right? So 1 shot of tequila, 100 calories. Your wine, so let's say you have a nice dry wine, 4 grams of net carbs. So you have 100 calories from the alcohol alone. And then the sugar is 4 times 4, right? 4 calories per gram. So 4 grams will give you 16 extra calories. So that's important to know, all right? So you go from having a shot, so you could do just your vodka, just your gin, just your tequila. That's gonna be 100 calories. Add a little sugar into that, even in the form of wine, and you have a little bit extra calories going on there. Same for beer, right? But then when you look at these ones on the bottom that have all the sugar, right? Oh my goodness. So let's look at the pina colada now. So 100 calories from the alcohol, and that's if you don't put an extra floater, right? If you put an extra floater on that, count 200 calories for the alcohol, plus 348 calories, extra for the sugar. So now you're up to a 500 calorie drink. That's crazy, crazy. Wow. That's a lot. All right. You remember this game from the 1980s? Pressure luck, big bucks, no whammies, right? Used to watch these on sick days because it was the only channel we had. So whammies. Alcohol may be the whammy to your success. If you're not losing weight and you're drinking a lot, you got to start thinking about this, and you got to start thinking not just about calories, but all the other ways the alcohol works against you when you start drinking. So those alcohol calories are not processed by your brain. They don't slow you down in any way. Your brain doesn't go, oh, okay, I've had 500 calories, therefore I'm less hungry. No, that's not what happens. In fact, you see number 2 there, alcohol actually increases your appetite. Also, it lowers your inhibitions. So you're going to make the choices that you normally said very easily no to, right? So when you're not drinking, somebody wants you to eat chocolate cake. No, I'm good. I don't need that. When you are drinking, it goes right in your mouth, right? And if you're hanging out in a bar, the typical foods that go right in your mouth are not helping your waistline. So those are problems, okay? The number 4 is a big one that a lot of people do not understand. So science has shown us that alcohol lowers our inhibitions, plus it causes a cortisol release. So the big deal there, what is cortisol? Cortisol is our stress hormone. In Accelerator, we learn when cortisol is in our system, we cannot lose fat. That is impossible. Those 2 things cannot exist together. So we know when we drink, when alcohol is in our system and when we're drunk, that cortisol is high. So there's no fat loss going on. We also have learned through recent science, as of like 2021, I'm talking very recent science, we have learned that alcohol actually raises your cortisol for 48 to 72 hours after you had a drink. What does that mean? So for 2 or 3 days, you feel generally more stressed out. you're less able to deal with the small situations that are happening around you. You're more likely to grab for another drink because you feel like you need it to slow down that feeling, right? This is the circular effect of alcohol. So the less well you're able to handle stress, and because of that, you're not losing weight. Cortisol is high, you're not losing weight. So that fat stays on your body. That is why some of the most stressed out people that you know will also be some of the most likely to grab for a drink, and also some of the heaviest people you know. So some of my heaviest clients that have trouble losing weight are the ones that are stressed out. And now we know that alcohol actually increases that stress hormone, the one that causes the problem. All right. This is Dr. Nora Volkow. She's director of the National Institute for Drug Abuse, also called NIDA. She's a psychiatrist, and she pioneered some of the recent research using brain imaging to show how substance use affects the brain. So she's pretty amazing. Here's some of the stuff that she has taught us when it comes to carbs. So here's a study. This was a pretty easy design, and this was in 2021. Patients who were admitted to an alcohol rehab were assigned to a low-carb ketogenic diet. That's what I teach. By the way, that is not the keto diet. That is not the same. What that means is it's a low sugar diet that makes ketones. So we burn a lot of fat, right? So like the keto diet, but not the same. So they're on a low carb ketogenic diet versus SAD. What is SAD? The standard American diet. You need to know. Researchers call the standard American diet SAD for short, because animals universally die and get sick when they're put on it, including you and I. So, all right, what happened? So here's the findings. Those that were put on the low carb ketogenic diet had fewer alcohol cravings reported. They required less sedatives while admitted. Those are called benzodiazepines if you're in the hospital. They had on their brain scans reduced levels of inflammation in the brain, and they had improved brain metabolism, meaning they could just see a whole lot more activity in the brain everywhere, right? So the brain was just working better. It was flowing better. So what does this mean? This means that if you're alcohol dependent, a low carb diet can mean you need less help, you suffer less, and your brain can heal faster. That's amazing. That's crazy stuff. So in other words, being on a low carb diet makes it easier to cut down on alcohol. And I think any of my low carbers kind of know that. We kind of all know that right away. So here's another study. This was even simpler design. So really simple design. And this has now been repeated because it was so simple in rats. It's been repeated in humans and been done in all different kinds of ways. So what did we do? Fed rats a low carb ketogenic diet versus the standard American diet. And then we got them drunk. So we made the rats drink the same amount of alcohol. Okay, what happened? The rats who regularly ate the low carb ketogenic diet had a 5-fold increase in blood alcohol. Yikes. So this is why I warn my people on Accelerator about alcohol, right? You can't start a low carb diet and then expect that this weekend you're going to drink the same that you drank last weekend. You will be really drunk. You could get injured. And I definitely in that program tell people, do not drive. Do not be the driver if you're going out this weekend and you're going to drink, because effectively you're a lightweight, right? And that's because your liver is making ketones and it's busy with that process. And because of that, it can't process alcohol at the same rate. So I think all of us who are on a low carb diet, we kind of instinctively know this, that we're no longer able to drink what we were in the past. And that's a good thing. It saves us a lot of money, and it kind of gets us on a pathway towards drinking a lot less over time. So, all right, let's review some of the good stuff. The positive effects of alcohol. Did Dr. Oz bring this to us? Dr. Oz talked famously about resveratrol. He has since called that the biggest nightmare of his life because everyone, when drinking says, Dr. Oz told me I should. So, but we've since learned that the amount of resveratrol that you need to take in order to have any kind of movement of the needle in the positive direction, it would include tons and tons and tons of alcohol, which you would never want to do for your health. So it's not really the end all be all. So you see the headline there, the small headline from the Mayo Clinic under alcohol use says, weighing risks and benefits. Drinking alcohol is a health risk regardless of the amount. That is true. And they chose their words very carefully because you have to know what are your risks and benefits specifically if you're going to drink. Okay, so here they are. Okay, so alcohol literature comes from observational studies. That means we have studied people for hundreds and hundreds and hundreds of years and watch the effects of what people report and what they drink. And we've documented that, and these things have been repeated over and over and over again. So effectively, that serves as proof. Okay. There's a little caveat. The biggest caveat in alcohol use is that it has to be in moderation. So what does that mean? Let's define that. That means 1 to 2 drinks in a day. And by that, I mean the drink equivalents. So that's not 1 to 2 big glasses of wine. That's 5 ounces of wine or maybe 10 ounces. For women, you're best off staying closer to the 1. Yes, there are some very large men that maybe can handle up to 4 drinks in a day and still be safe. So we know that from watching larger people who seem to be able to tolerate things a little bit better with less damaging effects. But in general, women want to stick closer to 1. Men want to stick under 3 to be very, very safe, okay? So, and if you're a small man, of course, the rules apply for small women. And if you're a very large woman, then you might be able to do a little bit more. So, okay. Science has also shown that the pattern matters. So that's 1 to 2 drinks a day, which means you could have 7 to 14 drinks a week and probably be safe. That doesn't mean 7 drinks on Friday or 14 drinks on Saturday. It doesn't work that way. It does not. So at no time should you be drinking to the point of drunkenness, because it doesn't work that way. Okay. All right, number 1, observed benefits of alcohol. Lowers the rates of gallstones. So if this is a particular risk for you, you may want to put this in your pro column for alcohol, right? So what are the giant risks for gallstones? There are 5 F's associated with it. Female, fat, 40 years old, fertile, meaning you've had a lot of children. And the 5th, probably the most important, is family history. So if there's a lot of people in your family that have had gallbladder disease and you happen to be a woman around 40 years old who's very overweight, this may be something you want to think about. So gallstone disease is not fun, painful, often leading to surgery, can make you very sick, can even be deadly. So that's something to consider. Lower rates of gallstones have been reported in people that drink alcohol in moderation. And I have that little glass there for a reason, right? That little glass is showing you about how much you should drink for the benefit, okay? People who drink in moderation also have decreased risk of type 2 diabetes. This is a big one. About a 30% reduced risk. That's kind of amazing. So, but we know this has been studied very closely, and we know that that means a half a drink to 2 drinks in a day. More than that or less than that had no effect. Weird, right? So you got to have the exact right amount. We know that alcohol makes us more sensitive to insulin. So if you're insulin resistant or you have metabolic syndrome, this is many of my patients, you may want to put this in your pro column for now, okay? All right, we know that alcohol increases HDL. HDL is the good cholesterol. This is the cholesterol that's very protective when it comes to heart disease. I talk to people about cholesterol all the time. I don't care how high your total is. I care 0 how high your total cholesterol is. What I care about is how high that HDL is, how high the triglycerides are, and the VLDL. If you're concerned about your cholesterol in any way, please send me your numbers. If you're my client, I'm more than happy to look at them. HDL is a very big deal. It goes up a lot with exercise. If you're somebody that is having a hard time getting your HDL up, you want to walk every day, but a little bit of alcohol can also do it for you. Okay. Next one, decreased clotting. This is a pretty big deal as well, okay? Clots lead to heart attack, stroke, pulmonary embolism. We're not just talking clots in the legs, but this does include clots in the legs. So we know that alcohol thins the blood. So this is pretty cool that we can decrease these things just by putting a little alcohol in our system every day. So if you're at risk for these, you have heart disease, stroke, personally, or a big family history of those things, personal history of clotting or pulmonary embolism, a little bit of alcohol might help you. All right. This is the giant one. Decrease in cardiovascular disease. This is what all alcohol manufacturers want you to know. This is big. This is because this is across the board. So alcohol in moderation is associated with decrease all types of cardiovascular disease. That means heart attack, that means heart failure, that means peripheral vascular disease, so disease in your arms and legs, circulatory problems, cardiac death, pulmonary embolism, like I mentioned. So valve disease, even arrhythmia, so funny rhythms in the heart, all of those across the board get reduced in drinkers. So as much as 40%. So not small. And this was observed in men and women. It's also observed in older individuals. So it doesn't matter how old you are, you can get the effect. And it also doesn't matter how sick you are. So if you already have heart disease, if you already have had a pulmonary embolism, if you already have heart failure, you can have this benefit from just drinking a small amount of alcohol. So amazing. So this is exciting for my drinkers out there, right? But keep in mind, more than that moderate amount of alcohol makes all of these things go higher, right? So it's got to be that moderate amount of alcohol use. If you do more than that, you're more likely to cause all of these than to prevent them. So the amount is important. Okay, and then there's the longevity studies, which is my favorite stuff, right? I teach all about longevity. So we know from the blue zones that people who drink in moderation tend to live longer lives. So what is that about, right? So we know that you don't have to include alcohol to live a longer life, right? Like the people out in Loma Linda, California, that's one of the blue zones here in the United States, they don't drink alcohol. They abstain from alcohol. So, but there's something about alcohol in some places that seem to portend a longer life. And we think that it's not just the alcohol, but perhaps, certainly some of that is the decreased cardiovascular risk, but we believe that some of it is also social and psychological, that those benefits of alcohol may be very important. So that can't be ignored, that, at the end of a stressful day, a little bit of alcohol can reduce anxiety. If you happen to have that little bit of alcohol among a bunch of family and friends that you meet with every day, like those little villages in Italy that have the longevity factor, we think that you have a greater sense of, emotional health. So that contributes a lot to longevity. So that's not nothing. All right. So part 4, coming up on the end here, we're going to talk about individual risk. Okay. So just a few scenarios, whether or not to drink is an individual choice. So drinkers and non-drinkers should not look down on one another. Your overall health and the risks of alcohol-associated conditions for you need to factor into the equation. So, okay, but both of those people, drinkers and non-drinkers alike, should look down upon drunkenness. Drunkenness is a sign of alcohol toxicity. Nobody benefits from that. Nobody. Okay. So I have on the screen somebody who looks healthy. If you are thin, you're physically active, you don't smoke, you eat a healthy diet, and you have no family history of heart disease, drinking will not benefit you any more than what you're already doing, right? So if this is you and you don't drink, there's no need to start. You shouldn't start. You're already getting the benefits of exercise from your exercise and your healthy diet, okay? What about this guy? If you're a 20 to 30-year-old man, even going into your 40s, the risk of alcohol-related accidents is actually quite a bit higher than the benefit that you might get from reduced heart disease, right? So no doctor in their right mind would recommend that this guy start drinking alcohol rather than exercise and eat better. That's crazy, right? In general, the same will hold true until he is at least middle age, when heart disease will pick up. Okay, what if you're a 60-year-old Black man or woman? This is a little different scenario, okay? So you need to know the risks for heart disease for Black men are highest, then white men, then Black women, then, then, what did I say? Black men, white men, then Black women, no, Black men, what am I saying? Black men are the highest, then white men, then Black women, then white women, then all Hispanic men and women, okay? So the highest rates of heart disease for those people. So if you are those people and you exercise very little, a drink a day may offer protection against heart disease. So that is likely to outweigh the potential harm. That's assuming that you're an individual that is not prone to alcoholism, of course. And I'm very likely to still recommend exercise and dietary change over alcohol, or at least we'll have a smart conversation about how to include both of those things, right? For the women in these scenarios, that breast cancer thing cannot be ignored. So there's an increased risk of breast cancer for any women on the screen that is including alcohol. So if you have a breast cancer history, you may want to lean a little bit more into exercise and eating healthy. But even for women where heart disease is the biggest risk factor, that breast cancer thing still has to be a discussion, right? Because the majority of women are actually more scared of developing cancer and requiring chemotherapy than they are of having a heart attack. So our own personal fears have to be factored into these discussions. So obviously, for some people, we need to avoid alcohol completely. That's pregnant women and the unborn fetus, right? Because of fetal alcohol syndrome. Past and present alcoholics, obviously. Anyone with liver disease is an obvious. If you're taking medications that interact poorly with alcohol, and when you're prescribed anything, you should look it up. You want to know that, because there are many things that interact with alcohol. You know, antibiotics, antidepressants, antihistamines, all anxiety drugs, anytime you're taking pain meds, anything you're taking like Zantac and Pepcid, Coumadin, all of those things interact with alcohol. If you decide you do want to drink in your life because it will benefit you, make sure that you are also getting plenty of folate-rich foods. So folate protects our liver and our brain from the effects of any alcohol that we take in. So make sure that you're doing that. Make sure that if you know somebody that drinks a lot of alcohol, they're also eating a lot of greens, okay? Feed them salads. All right. And then of course, you know, if any of you are thinking like at this point, I need to cut back, I offer you this kind of start, right? A low carb healthy diet is something that I teach, and it's a great launching point, a great initiative for trying to get healthier and cutting back on alcohol. It makes it that much easier. So this is the type of strategy stuff that we talk about all the time in the SWAT team, right? All the time. So, all right, that's about everything, guys. If you love this education, let me know. I'm going to plan on doing stuff like this every month, and I'd love to know what else you want to talk about. If I can help you with your health journey, let me know. You see all the places where you can contact me. I'm everywhere. Emergency Health Fix is on every form of social media, just about. Not TikTok. I'm not on that. But you can follow me anywhere, and get on my email list if you're not already on it. You do that on my website. You see it there, emergencyhealthfix.com. And the last thing I would just want to make you aware of is that Valentine's Day flash sale that is here, right? It's only until midnight tonight. So if you love this extra education, in addition to all the stuff you get in my programs, the SWAT team is where I do that. And only until midnight tonight, I'm offering that anyone who signs up for any program in March will get a SWAT team month for free. So you can experience all the types of extras that we learn. So, okay. I think that's everything I wanted to share with you guys tonight. Thank you for coming, all of you guys that showed up live. And I will see you next time. I haven't decided what I'm going to talk about, so you guys let me know what you want to talk about.
I've got something for you. I'll text you separate.
Okay, fabulous. All
Okay.
right. Have a good night, guys.
Right. See ya.
Oh.